We're joined by ABC Chief Medical Correspondent Dr. Jen Ashton, and as always, we are tracking the major developments for you. And with the U.S. now averaging 70,000 new cases a day, a surge of nearly 74% in just the last month. Let's get the latest coronavirus numbers from Johns Hopkins University. At least 44 million confirmed cases around the world now, more than 8.8 million of those cases here in the U.S., with now more than 227,000 American lives lost.
All right, and Doc, you always talk about the ripple effects of this pandemic. A headline, New York Times, saying that the rates for sexually transmitted infections plummeted during the pandemic. Now, you might hear that first and say, oh, well, goodness, that's great.
Right.
Well, you got to get into some details.
The story behind the story here, TJ, and to be clear, for some perspective, we came into 2020 expecting to see the peak rates of sexually transmitted infections. Now we're seeing the consequence of this pandemic. So rates of chlamydia, gonorrhea, and syphilis, these are all reportable to the state departments of health, have dropped this year, largely due to the following factors. Contact tracers for both gonorrhea and syphilis have been diverted to become contact tracers for COVID-19. It's estimated that 80% of sexual health screening clinics have either reduced their hours dramatically or closed entirely. And just salt in the wound, the STD testing supplies themselves, the reagents, the swabs are running low. And lastly, of course, there's a concern that people are not coming forward for regular routine health screening, sexually transmitted infection screening, because they're afraid of being exposed to COVID.
So it's not that the infections or the diseases have decreased, it's that people just don't know about it, which,
right.
What are the medical implications for that?
Well, right. They're just not being reported. They're not being diagnosed. They're not being detected. The estimates are that if these service interruptions continue, we could see in excess hundreds of cases of HIV, thousands more cases of sexually transmitted infections, which, to be clear, then can lead to pelvic inflammatory disease, infertility. When you talk about effects on a newborn, if these occur in a pregnant woman, blindness, or death. So again, we have to keep our eyes on multiple infectious diseases at one time, not just COVID.
Right. Wow. Full health has to always be considered.
Sure.
All right, Dr. Jen, thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.